Hey, good morning, everyone. Thank you for joining us. Welcome to the Swetland seminar. As you all are joining, please share your name and the organization you represent in the chat box. I'll start with a little intro about the Swetland Center. So if you're not familiar with our center, in the late 1950s, David and Mary Swetland felt not enough was understood about the unintended health consequences of chemical, agricultural, and industrial products in our environment. So they focused the Mary Ann Swetland Professorship of Environmental Health Sciences on preventative medicine and the threats of man-made environmental hazards, so that all graduating doctors would have an interest in and understanding of the impact of the environment on human health. And today, the Swetland Center continues Mary Ann Swetland's legacy by building partnerships to find and scale solutions to redress the environment's disparate impact on low resource populations in Cleveland and beyond. As research continues to demonstrate the vital connection between the environment and health, the center is positioned to respond. And our mission is to study the complex interplay between environmental determinants and population health outcomes. And the center places special emphasis on community engaged approaches that address the role of structural racism in creating and sustaining environmental health inequities. We seek to translate these findings into policies, practices, and relationships that promote community and population health equity. If you're interested in learning more about the Swetland Center, you can check out our website at case.edu/Swetland. And I also put that link in the chat as well. You can also email us too. Okay. Our next Swetland seminar will be April 16th. That's also a Tuesday from 9 to 10 a.m. on Zoom. And our presenters will be Jill Clark and Katie Merritt. We're going to be adding registration details to our website soon, so check back later for those details. Okay, now I will turn it over to the director of the Swetland Center, Dr. Darcy Friedman.
Good morning, everybody, and welcome to our first seminar for the 2024 year. I want to start off by acknowledging that this seminar is co-sponsored by the Prevention Research Center for Healthy Neighborhoods and the Master of Public Health program at Case Western Reserve University, and it's conducted in partnership with the Case Western Reserve University Population and Community Health Initiative. So I have the honor of introducing two amazing people who are our speakers today, Dr. Dara Mendez and Laura Ann Bray. Dr. Mendez' research, practice, and instruction include health equity, reproductive justice, and anti-oppression praxis, as well as applications of Black feminist theory and public health critical race praxis. She focuses on understanding and addressing racial and socioeconomic equity in pregnancy, birth, and women's health. Dr. Mendez has developed approaches to measure and understand how structural and social contexts intersect to contribute to health, particularly for the health of Black women, femmes, and gender-expansive people. She also leads several projects focused on community health and policy interventions aimed to achieve health equity. Her work has been funded by numerous funders like the NIH, CDC, Kellogg Foundation, and Robert Wood Johnson Foundation. In her role at the University of Pittsburgh, she has served as the former interim director of the Center for Health Equity, which we'll hear about today. She's currently the associate director of that center and founder and current director of the Health Justice Scholars and Maternal and Child Health Equity Scholars Program. She also serves as executive member of the Black Equity Coalition, health editor for Block Chronicles, and co-founder of the Pittsburgh Latinx Artist Residency Program. Dr. Mendez received her bachelor's degree in sociology and anthropology from Spelman College, an MPH in maternal and child health, and PhD in maternal and child health and epidemiology from the University of North Carolina, Chapel Hill, and she completed her postdoctoral training as a Kellogg Health Scholar at the University of Pittsburgh. Currently, Dr. Mendez is an associate professor of epidemiology at the School of Public Health at the University of Pittsburgh. Ms. Laura Ann Bray is the manager of Community Partnerships, Education, and Training at the Center for Health Equity, or CHE, in the School of Public Health at the University of Pittsburgh. Laura Ann is responsible for the administration and management of CHE programs, including the Community Research Advisory Board, or their CRAB, which I think we'll hear about today, their Barbershop Health Outreach Program, Journal Club, Student Scholarship, and Pathway programs, and for developing strategic community partnerships. She joined the center in 2003 with experience in data management, cancer education, program planning, and clinical trial recruitment. She's a graduate of the University of Pittsburgh with a bachelor's degree in psychology and a minor in Black Studies. Laura Ann is currently pursuing a master's degree in public policy and management at the University of Pittsburgh Graduate School of Public and International Affairs. So we're excited to have Dara and Laura. And after their presentation, we'll have time for questions and answers. And you can also add questions to the chat as we go. So you don't forget your question. And we'll start with those in the Q&A time. So with that, I'd like to turn it over to Dara and Laura. Thank you.
Thank you so much for the kind introduction, Darcy, and thank you for the team for the invitation. We're really thrilled to have the opportunity to share with you all more about the work of the Center for Health Equity. So before we jump in, I just wanted to also give Laura Ann an opportunity if she wanted to also mention anything at the beginning of our talk.
Again, thank you for inviting us and looking forward to our time together and learning about your center as well.
So we see this, just our time together in this presentation as an opportunity to not only share a bit about the origin and history for the center, key programs, approaches and strategies, accomplishments over the history of the center, but also ways in which we can build collaboration and synergy. Just based on initial conversation that I had with Darcy, there are a number of activities, strategies that are happening within the Center for Health Equity, but across the University of Pittsburgh that I'll mention at the end that I think are really synergistic with what you are doing at the Swetland Center, but also the further development of the Midtown Center. So I wanted to just briefly share with you the core team that is involved in making sure that the work that we do happens on a day-to-day. So I serve as associate director, former interim director. We're in the process of actually hiring a new director for the center. Dr. Tiffany Gary Webb also serves as associate director. She's also associate dean for diversity, equity, inclusion for the School of Public Health. Dr. Emma Barinas Mitchell, she is the director of the Health Equity Certificate Program, and we'll talk about that, and has an instrumental role in curriculum and training across the School of Public Health as it relates to health equity. Patricia Docume was our former scientific director for the center, and she also directs our Latinx areas of concentration, both in the research and community-based settings. The lovely Laura Ann, who's here with me as well, is our manager and keeps the day-to-day, making sure that we are able to accomplish the goals in our main pillars, which we'll talk about. Noble Maseru, he's our senior advisor, former CHE director, but he has an instrumental role across the health sciences. So it's really great because his role as social justice, racial equity, and faculty engagement across the health sciences really helps to bolster and support the work that we do through the Center for Health Equity, which is primarily based in the School of Public Health. Richard Garland, he is retiring, and he is a professor who has focused in our injury prevention work. Amrit Singh is a project coordinator who is leading one of our main collaborative projects with the Community Research Advisory Board, which we'll talk about later. And then Victoria Udo is a research assistant who helps support a number of programs, and primarily the Health Justice Scholars Program. We have a number of affiliate faculty. I won't list them all. Some of these names you all may actually recognize because several of them are in the area of concentration around environmental health, environmental justice, and health disparities, which I know is central to the work of the Swetland Center.
So I'll talk a little bit about our history. As it was stated in my introduction, I joined the center in 2003. So just prior to my arrival, the center actually was in place for a period of time. It was founded in 1994. Our first director was Dr. Stephen Thomas, and we had as our associate director, Dr. Angela Ford. And they really worked hand in hand and committed to translating evidence-based research into community-based interventions and innovative outreach practice. And that was the bulk of everything that we did. It was always community focused and community engaged. So in 2001, the center, through some wonderful foundation support, we established the African American Health Promotion Campaign. And then that launched several of our initiatives, some of which are still in existence today. The Community Research Advisory Board was one of them, the Health Disparity Working Groups, Health Advocates in Reach, which is our hair barbershop outreach program, and also in some salons. We had a program connected to the barbershop salon outreach called Take a Health Professional to the People Day. We also had a Healthy Class of 2010, a partnership with Pittsburgh Public Schools, in which we engaged several students and worked with them all the way into their graduation class of 2010. And we also were the hub for the Cancer Information Service, which was a program of the National Cancer Institute. And that's what actually was the role that I played when I first arrived at the center. And then moving on with our history, we were fortunate, like I mentioned, with the funding. The center was named twice as a Center of Excellence in Minority Health Disparities. We launched a Healthy Black Family Project, and we'll talk about all of this in more detail as we go through the presentation. We also established a graduate certificate program in minority health and health disparities. We were a training site for the Kellogg Postdoctoral Scholars Program, which is actually what brought Dara back to us in Pittsburgh. And then in 2010, we had a little bit of a transition in our leadership. And that's when our name changed during that period, 2010, 2011, to the Center for Health Equity. And Dara already mentioned how Dr. Patricia Docume in the introduction slide, she served as our scientific director, really grounded us. And through Patricia's leadership, that's when we developed our journal club, Emerging Latino Communities and Engagement. So a lot of work and some strategic planning happened during her leadership from 2012 to 2017. Dr. Maseru assumed the role as director from 2017 to 2020. Again, more outreach engagement throughout the university, which we'll talk about, happened under his leadership. And of course, Dara's leadership continued as the interim director 2010 to 2021. And as she mentioned, we're in the process of hiring a full-time director. So even during all this transition, one thing remained the same, and that is our commitment to community engaged work and partnerships.
So I wanted to briefly mention in 2017, the Center for Health Equity underwent a strategic planning process. That is something that we will be revisiting as we onboard a new director to revisit not only some of our core strategies, but our vision, mission, and goals, and our commitment to health equity in collaboration with community partnerships. But really, this was an opportunity for the core faculty through the Center for Health Equity, faculty across the School of Public Health, as well as our community partners, had a number of working groups and conversations to develop this strategic planning process and final strategic plan. And this just lists out some of the key elements of that. So that included larger involvement of CHE at the government, community, university, and school levels. Advocacy for equity to become a crucial component of all university and school initiatives, increased community engagement in coordination with the newly formed Pitt Centers for Community Engagement, which I'll mention at the end of the presentation, and then the creation of formal and informal spaces for cross-disciplinary collaborations. And so our overall vision for the center is to understand and ultimately eliminate health inequities in under-resourced, vulnerable, and underserved communities and populations, with a particular focus in Western Pennsylvania. Our work, though, I would say, expands beyond the Western Pennsylvania region, but that has been our primary focus. And CHE focuses on excess premature mortality and populations experiencing health inequities with 4 major aims. So one is to gain a further understanding of the causes of health inequities, with, once again, a focus on Western PA, specifically Allegheny County, which is the county seat for the city of Pittsburgh, to develop, implement, and evaluate interventions designed to reduce those inequities, to provide capacity building services, community organizations in our region, and to disseminate findings and experiences through CHE website, conferences, peer-reviewed publications, and other communication strategies. So through that strategic planning process, the Center for Health Equity developed 3 core pillars and goals within those pillars. And so we anchor our work within these 3 areas. We'll present some examples and accomplishments within these 3 areas, but are absolutely open for question and answer at the end, because we won't have the time to cover everything, but we want to give you a little bit of a snapshot. So first is research, and that is advancing health equity through research, scientific inquiry, and innovation. The second is service and partnerships. So this really speaks to our community partner work. And this is around advancing health equity across the lifespan through faculty service and cooperation with partners at the national, regional, national, and global levels. And I would extend to say that this goes beyond faculty service to partners across the area within the academic institution and outside of our academic institution. And then finally, education. So this is preparing scholars and leaders through rigorous education, training, and professional development programs.
So yeah, our core pillars, as Dara mentioned, in research, particularly when we focus, we were looking at what we do in Latino communities, and we have partnered with community organizations that service Latino populations on various research projects. And we have health equity research studies, of course, that span the lifespan. And then we have a program that a research program around REACH, which we will talk about in detail. In an education area, how we address the core pillars, we actually host a monthly journal club in which students, faculty, staff, and community members, so everything is also is an invitation to community be involved. And we discuss a health equity topic of interest. We have co-facilitators, usually a student and a faculty. We like to have a multidisciplinary co-facilitation. And it's informal, but we do expect that you read the article. And we talk about and look to solve solutions around some of the health equity issues that may be regional or national, and we like to have like a local lens to see if we see those same issues locally and think of solutions to address them. There's a health equity certificate for graduate students. The center also hosts focused writing sessions, an opportunity for anyone just to come together and write on projects, and that's actually hosted like weekly. We have a collaboration with our other schools of the health sciences, particularly the School of Medicine, on some pathway programs for middle school students as well as high school students to introduce them to careers, pathways in the health sciences. And we do have a Health Justice Scholars Program that is in our 4th cohort that Dr. Mendez actually developed and created. And then as it relates to our partnerships and community engagement, of course, we'll talk about the CRAB and the HARE initiative. We have a violence prevention initiative as well that works with various partners at the local and county level, as well as trauma centers, so that we can also, again, look at solutions and look at trends around violence and actually some workforce development in order to move people into a better position in their life. We also have a water equity task force that our membership and leadership is part of, the Allegheny County Birth Plan in collaboration with Healthy Start and some other organizations that work in that space. And then we're also part of Human Rights Working Group, where we've advocated policy around making sure that racism was called out as a public health crisis. And our leadership was very instrumental in having that adopted by our city and county. So we're in various spaces and believe that that's where we need to be in order to push health equity forward.
Sorry, I didn't realize I was still on mute. I'll just mention really quickly under our educational pillar, we also have been engaged in the development of the new Bachelor's of Public Health and being involved in the development of the introductory health equity courses and other curricular needs as it relates to health equity for the new BSPH program. Right. So this is just an overview of some of the research initiatives, some of which Laura Ann mentioned a minute ago. And I would say our work spans a life course, and some examples include our Black Women and Femmes Health Project, Live Well Allegheny, which is our REACH initiative, Harm Reduction, Violence Prevention Initiative. We work closely with the CRAB on a number of research-related endeavors, in addition to it being a space and a platform for researchers to receive insight, support, and consultation. And then we have informed interventions such as RISE's, the Pittsburgh Study, and Cuento Conmigo, which we'll talk about a little bit later. And as I mentioned, our work spans the lifespan, and we try and anchor our work as it relates to not only those individually focused research studies and projects, but how do they connect? And here's just an example. As I mentioned, we'll go a little bit into detail on some of these. So in addition to our research in the birth, postpartum space, all the way through adulthood and aging, we have a number of initiatives and collaborations that involve multiple populations, such as the Black Equity Coalition, the Pittsburgh Collaboratory for Water Initiative, and the Pittsburgh Study. Over the past fiscal year, we have been able to support our work through a number of federal, foundation, and state grants and contracts. So the Center for Health Equity is not a cost center. So what that means is that we are an initiative, we are a center that carries on our work, but we do not directly receive funding through the center as a cost center, which means that our federal foundation and state grants and contracts are led and PI'd by a number of faculty, core faculty and affiliate faculty with the center, which then in turn supports our ongoing work. So we're actually going through a process of revisiting that with the school, and I can answer any questions later just about the funding model and what that means for the center, and what that has meant for the university as well. So we'll just share a little bit about some of our featured research initiatives. As I mentioned, there are a number that we're engaged in. Our website, I listed it at the beginning and you'll see it in the final slide. We have our annual report, which details our ongoing work over the past year. We typically develop an annual report that summarizes our work, but you can also find more information in our website, and we're absolutely open to answering questions. So I know you all are familiar with REACH. Our REACH initiative is called Live Well Allegheny, Lifting Wellness for African Americans. And our work in the county has really centered around community engagement, promotion of healthy behaviors, and connecting residents to resources. Our former PI of our REACH initiative is your health department director there. So we have some very close connections. Your health equity lead at your health department there is actually former faculty and former affiliate faculty for the Center for Health Equity at the University of Pittsburgh. So there's some great connections to the work that has been done in Allegheny County in tandem with what you are doing there. And this is just a schematic of the key partners. So this was our original sort of overview of the core elements of our REACH initiative, along with University of Pittsburgh. So we formally, but no longer, served as the core evaluation partner. And our role for evaluation was not only to understand and review metrics as it related to core outcomes for REACH, but we were very instrumental in integrating racial equity and anti-racism praxis and processes throughout our REACH initiative. And REACH focused on 6 communities in Pittsburgh: Garfield, Hill District, Larimer, Homewood, East Hills, the Mon Valley, North Side, and Wilkinsburg. So this was a combination of neighborhoods and communities within the city, but also outside of the city in Allegheny County. They were identified based on access to resources and also a number of metrics as required by the CDC with respect to communities that were focused on African Americans or African American communities, but also had a higher level of poverty. Our core partners under the nutrition area included the Pittsburgh Policy Food Council, UPMC Children's Hospital, the Food Trust, Healthy Start, and the Pittsburgh Black Breastfeeding Circle. physical activity really focused on development of the built environment, and that was the Allegheny County Economic Development. And then our community clinical linkages was led by Duquesne School of Pharmacy, the YMCA, and the Greater Pittsburgh Food Bank.
So Dara mentioned earlier, Dr. Patricia Docume, and I've worked with Dr. Docume for many years, and she was our scientific director. And under the umbrella of the Emerging Latino Communities group that she created, we were able to, as a center, then leverage those partnerships and bring in students who had the opportunity to intern and to participate on many of the initiatives that are before you. So the assessment of Latino youth mental health, one of the challenges in a lot of emerging Latino communities, not only in Pittsburgh, but throughout the country, is the isolation factor. And sometimes when we have populations that are new to an area, they're migrants, they have the language barrier. There is also the stigma and isolation and mental health. So they did a research study looking at some of the issues around mental health, and then also looking for solutions, and solicited here with Casa San Jose just recently with some vaccinations, but they were also involved in many of these other initiatives too, to prevent depression and, as I mentioned, social isolation. And also just recently, Dr. Docume, along with some students and other faculty within the University of Pittsburgh, actually worked on a health engagement needs assessment in Lawrence County. So it's a county that's just a little north of where we're located here in Pittsburgh in Allegheny County. And actually we're able to work with organizations there and to really help Lawrence County and the Department of Health and Human Services there uncover some of the issues that Latino population was facing, and is offering them additional support. And I think Dara is also involved in some of that work as well. So it's not only here in our county, but we work in our serve as a resource for any other organizations, particularly in Western Pennsylvania, that may need our assistance and help around qualitative research and other components that we bring as a center.
I'll just mention, thank you, Laura Ann, for just a sort of reminder about the assessment, right, in Lawrence County. And we've also been engaged in a new assessment that's happening here in Allegheny County. There have been assessments among the Latino population, but have been led by government agencies that really have not maybe centered the types of methods or questions that would really get to the needs of the population. And so CASA is actually leading what would be considered a community-owned and operated data collection process. So we're supporting them to lead that work, providing the technical assistance and resources for them to then own their data, to be able to understand the needs of the population through research and evaluation. So Dr. Maseru has been leading efforts around an equitable water future initiative. I'm sorry, was there a question? Okay, sorry, I thought I heard a question. So this is really the U.S. Water Alliance and Pittsburgh leaders representing the Pittsburgh Water and Sewer Authority, the community-based organizations that are involved, in academia. And there is a task force that have been outlining key strategies. And really it's around promoting a diverse workforce, green jobs, water affordability, clean and safe water and infrastructure. Dr. Maseru has been instrumental in ensuring the connection across a number of initiatives with the Pittsburgh Water and Sewer Authority, but this has also involved other water authorities and surrounding municipalities. So for those of you who are familiar with Allegheny County, we have more than, is it 130 municipalities? Laura Ann, always get the number a little bit wrong. It's about 130 municipalities. So that's the city of Pittsburgh plus our multiple, if you will, towns and cities outside of the city. And so you can imagine what that means in terms of not just equitable water and supports there, but a number of initiatives that may revolve around government leaders and officials coming together. Were you going to say something, Laura Ann, to that?
No, it's a nice lead in though to the next slide. Just your reference to the municipalities and how we're bordering each other. The city of Pittsburgh, if we're talking about city limits, I mean, we have Wilkinsburg, which is quote unquote outside the city, but some of these municipalities, the lines just as far as we're concerned, overlap, and our work is regional and throughout the whole county. And so with our violence prevention initiative, right, violence unfortunately doesn't have any bounds, and it can happen and erupt anywhere, which we know, and unfortunately in so many scenarios and cases. So Dr. Garland, Richard Garland, has been very instrumental with his own work prior to coming to the University of Pittsburgh and bringing his vast knowledge of working in various communities, understanding about violence and the interruption process that needs to be put in place in order to help mitigate some of the situations that we see. So that's where we had the homicide review process, and we do have on our website many reports that were authored that discuss the trends that we saw in homicide, and even down to the times that homicide and gun activity would occur in certain neighborhoods. And we needed that kind of lens in order to then create some type of intervention, even with when someone was unfortunately impacted by gun violence and they were taken to the hospital. Mr. Garland and his team of interventionists would actually meet people at the hospital and talk with them. And so, of course, that was a collaboration with our trauma centers and many of those surgeons and nurses, and an opportunity just to talk with those individuals to see what some of their issues were. And in many cases, some people were even relocated out of the city or out of the area where they were victimized. And if that included their family, we also had partnered with social services to provide that type of level of intervention to help people. And then the Reimagine Reentry program, as a result of everything that the team saw, Richard now puts a lot of his focus on making sure that there's training. So when people who may have been the perpetrators of violence re-enter into society and into their neighborhoods, giving them some hope, giving them training. And so we are partnered with a lot of the local organizations and local employers to give them that type of workforce development and training. And it's both men and women that are involved in Reimagine Reentry program. So it's really something that we know through case management and someone really being in a person's corner that you can turn the tide around violence prevention. So we're very proud of that program for sure. So the fact that Richard's going to be retiring, we're gonna miss that, but we will still be very much engaged in those activities as a center. And so the next slide, where we talk about some of our featured community engagement with the CRAB, a few slides here, and then Health Advocates in Reach, and then Dara will talk about the Black Equity Coalition. So our CRAB, which I have the pleasure of being the liaison with the CRAB members, it was established in 2001. And it was established because the center was receiving numerous requests from investigators. They wanted our leadership of the center to serve on their advisory boards and assist them with their recruitment. And at the same time, the center was hearing, because we are very well entrenched in the community, concerns from the African-American community just wanting to have greater understanding and knowledge about the research process. They were getting requests and seeing flyers and information about research studies that they were unfamiliar with from researchers that they did not know. And so the center recognized that there was an opportunity for us to bring the investigators and community members together. And then we established a forum in which those lines of communication could be fostered. And that is our Community Research Advisory Board. We're so fortunate to have our current CRAB co-chairs, Mr. Mario Brown, who's the Associate Dean for Equity, Engagement, and Justice, Associate Professor, Pharmacy and Therapeutics at the University of Pittsburgh School of Pharmacy. And Mario was a member of the center, who was one of our project directors for the Hair Barbershop Initiative. So we have a long relationship. And Ms. Victoria Garner, who now serves as the Development Grants Manager at the Neighborhood Academy, she's our CRAB Community Co-Chair. So we have an academic co-chair in Mario, and then we have a community co-chair in Victoria. And Vicky also was a member of the staff of the Center for Minority Health when we were initiated years ago, and handled our public relations and communications. So both of them are very committed to the mission and vision of the center and have that historical reference that we needed as we transitioned over the years into naming them as our CRAB co-chairs. So in our next slide, just continue about the CRAB's impact. I mean, over the years, we've had multiple research projects come before the CRAB. And how do people learn about the CRAB? There's so many sources of referrals now that we are entrenched in the university as well as in the community. So we get referrals from Pitt's Center for Translational and Science Institute, from the Community Engagement Centers, from other schools of the health sciences. Other researchers who presented to the CRAB will inform their colleagues about this opportunity. Also, we ourselves recruit and inform the community, because our presenters at our CRAB are from various places. So they're not just from the University of Pittsburgh. I mean, we've had presenters come from the hospital systems, from other universities, who want to get that informed perspective of community members on their projects and on their work. And then the CRAB, we've also worked more long-term on certain projects. So we've had some of our CRAB members serve as subset of the CRAB as a consultation source on a study looking at seroprevalence of COVID-19 in the community. And then we also are involved right now on an Alzheimer's biomarker consortium Down syndrome supplement that we call ADORE. And we're here as a CRAB to help develop and review research protocols. That's typically what we do at our monthly CRAB meeting. But then we also do more additional work in development of community-based participatory research and health equity training through our ADORE supplement. And we have a collaboration with the Forbes Funds, which is a local foundation that grants organizations. And as a CRAB, we actually review their management assistance grants. So those are grants that the Forbes Fund gives to community organizations for technical assistance and capacity building. And some of our CRAB members have the opportunity to review those grants and then help the Forbes Funds in determining whether or not those organizations will actually get funded. So we have a large role in what happens in community participatory research, not only through who we see coming before our CRAB, but then also how organizations actually get funded. And then our Health Advocates and Reach program that was established in 2001. So when that was established, the center did some needs assessment, some observational scans to identify barbershops and hair salons to invite to participate in the program. They agreed that, yes, we would like to have lay health advocate training. So that's what the center actually offered to the barbershops and hair salons that became part of our network. Was we wanted to make sure that the shops understood our role to help them with their clients, with the barbers and the stylist, to give them the training that they need around health equity, health disparities, some of which, of course, they already may have some of those situations and health issues that they were also having experience, such as high blood pressure, which is, common in the African American community, diabetes. So those are some of the training that we provided. And we also ensured that they were trained in CPR training. And so then the shop got recognized as one of our health advocates in reach. And what the center does, and we still do, is have health screenings in the barbershops and hair salons. We bring in health education. So we'll partner with many organizations and individuals who have content that is evidence-based, that is relevant to the population that we're working with, or who the shop sees on a regular basis. And then we work collaboratively on their terms to bring this health information into their shops. So when we host the Take a Health Professional to the People Day, that's like this one big health fair that the center in past years has done simultaneously in all of the barbershops. And at the height, we had like 12 shops involved in our network. So we would have happening at the same time throughout the city, 12 little mini health education and screening events happening at each shop. So you can imagine the logistics of all of that and the amount of staff that it took to pull that off. But it was a wonderful, when I joined the center, introduction to some of that community-based work that was in place at the center. And so we still do a little Take a Health Professional to the People Day, not simultaneously in a whole lot of shops. Sometimes it's over a week, where it's more like a Take a Health Professional to the People week. But we still have the blood pressure screenings occur. And just recently, we also collaborated with the Black Equity Coalition and some of the other community-based organizations to offer COVID-19 vaccination screenings in the barbershops, as well as flu shots. So we stay relevant, and we're always making sure that we bring the necessary prevention methods and screenings to that population whenever we can. And I could talk more about this later, but yeah.
Which is it's a beautiful segue. Thank you, Laura Ann, to the Black Equity Coalition. As Laura Ann, the BEC has been a coalition that has essentially used a hub and spoke model to support ongoing initiatives and to really synergize Black thought leadership in the city. And this really came out of a response to the pandemic. So we used to be called the Black Equity COVID Coalition, and changed the name to Black Equity Coalition to not only talk about the concerns of the pandemic, but concerns for Black communities in the region, but also in collaboration with other communities that have been historically and contemporarily excluded, such as Latino populations, low-income populations. And this, as I mentioned, came out of a necessity because at the time, many of us in this space, both physicians, researchers, epidemiologists, community funders, governmental officials, really felt like the concerns and needs of the Black populations weren't being paid attention to or weren't being centered. And so we established this community-oriented preventative health care infrastructure. One of the key elements of our sort of framework is this hub and spoke model. So thinking of thought leadership across multiple spaces. Our data working group is one of the foundational elements to the history of the Black Equity Coalition, because we developed and designed ways to look at data related to the pandemic. So exposure potentially to COVID-19 before we had data on race, ethnic breakdown of infection. And that was really important for not only the work that we were doing, but also the work of our local and state health departments. And I can share more during the Q&A, but for the sake of time, I'm going to go on to the next. So we wanted to end with our third pillar, which is learning, training, educational initiatives. I'll briefly talk about a few of these in the next subsequent slides. So we have the health equity certificate, the journal club, which Laura-Ann already spoke about, focused writing, emerging Latino community reading group, maternal child health equity scholars, and the health justice scholars. So I'll mention those in a minute, but Laura-Ann is going to share a little bit more about these initiatives as well.
Yes, just quickly, for, again, the sake of time, the center administers the Goldstein Award. It's actually a scholarship for a graduate student in environmental health disparities. So the student has to be doing some type of project in environmental health disparities. And every other year, in collaboration with the Center for Public Health Practice, we will administer this award. It's a competitive award. We get every year a lot of good applications, and it's always a challenge, but it's always something stellar that students are doing in our local community around environmental health. And then the high school and middle school programs I mentioned earlier, we serve as a liaison when the students actually rotate through the School of Public Health. The center is responsible for the programming, collaborations with faculty and other graduate students to serve as those mentors on panel discussions with the students. And these programs actually then bleed and lead into our bachelor's in public health and public health science academy that our School of Public Health actually initiated. So it's a lot of cross-disciplinary collaboration, but we are definitely committed to identifying and helping transition the next generation of public health students.
So just really briefly, the Health Equity Certificate is a graduate program certificate. It includes a total of 15 credits. Here's a list of core courses. Other requirements include the Health Equity Journal Club, a health equity focused practicum and/or independent study. The Maternal Child Health Equity Scholars Program was founded in 2018. And this was developed because there were a number of students and scholars across the continuum who were interested in maternal child health, reproductive justice, and sexual reproductive health. And so this served as just a community for scholars to come together. And then when the pandemic hit, our sort of participation exploded because we were able to have a virtual environment for people to continue to support and engage with the core content. And so this just allows for an opportunity for scholars to build their own work, but to learn from each other. And then we have the Health Justice Scholars Program. This was initiated in 2021. This serves as a scholarship program for graduate students in the School of Public Health who are interested in developing their capacity around health equity and justice. They also have an opportunity to learn from our core faculty, but also engage with our community partners. This is just a picture of all of the scholars that have come through the program. They're across disciplines. They have varying interests, and a number of them have continued to engage in health equity content beyond their tenure as students at the School of Public Health. And then I wanted to end with other University of Pittsburgh initiatives and collaboration. So we understand as a center, we are not successful by working in silos. So we collaborate quite a bit with partners across university. We mentioned a number of our partners outside of the university, but I wanted to uplift some of the internal partnerships that I think have been instrumental, particularly in the past several years. So our Associate Dean for Diversity, Equity, and Inclusion has been in a leadership role with the University of Pittsburgh Cluster Hire, which has focused on race and social determinants of equity and well-being. This is developed and led by our provost office at the university and provides funding and support for hiring a faculty across multiple disciplines. So not just the health sciences, we have faculty that are being hired in what will be considered our upper campus or in the areas of arts and sciences. We also have the School of Public Health Social Justice Action Committee. This was initiated by our former director, Noble Maseru, which includes a number of key action items for the school public health around social justice, and we can talk about that a little bit later. We also have CHEER, so this is the Center for Human, Environmental, and Equity Research. This is led by collaborator Aaron Barchowski, and our Community Research Advisory Board has been involved in CHEER with respect to ongoing projects that are happening within CHEER. So this is a University of Pittsburgh based pilot initiative, if you will, and they are in the process of applying for center grants through NIH to expand the work. There's also the Pitt Community Engagement Center. So I mentioned that really briefly earlier. These centers are based in community areas to allow for collaboration within specific neighborhoods. So that includes Homewood in the Hill District. These are predominantly and historically Black neighborhoods in our city. A number of schools and divisions across the university collaborate and work through the CECs. We have the Pitt Race Equity Based Centers Collaborative, and this lists all of the centers and initiatives across the university that collaborate on what would be considered race and equity-based research, but also praxis and initiatives. In the fall, this beginning of the school year, we had a conference that involved work and synergies across all of these centers. And then finally, the Pitt Momentum Funds. So although the Pitt Momentum Funds is not centered and focused on equity, each year they do typically have a theme, and in prior years they have focused on issues of diversity, equity, and inclusion. But this is, I named this because this is an internal funding mechanism and investment from the university to really support new and innovative ideas and pilots. And so CHEER in particular was an awardee of a scaling grant, which provided $200,000 per year over 2 years to lay the foundation for CHEER. And then I wanted to end with just some next steps and sort of things looking forward for our center, which is onboarding a new director, development of our new strategic plan and directions, continued collaboration across the centers that I mentioned and the CEC, expansion of our community-based partnered initiatives through CRAB, HAIR, and the Latino engagement work, development of further health equity content for our new BSPH program, as well as continuation, but also execution of new research studies within the health equity area of concentration.
And we'll close with saying thank you very much. You can find out more about our programs by visiting our website. We have an email address, which is a center email, and then my email. And our annual report is on the website for further review. So thank you very much. And we're now open for questions.
We're open for questions. We know we left minimal time for questions. Maybe 10 minutes, but we're welcome to open up to any questions, and we can even hang on for a little bit if that's okay, Dr. Darcy, knowing that we have the next meeting at 10. So
Wait,
I'll stop sharing if that's okay.
if no one has a question, I have a question to start. I mean, first of all, you guys are doing amazing work. So helpful to hear what's happening and all the varieties of ways that you're connecting, you're webbing the resources to make things happen, which is really cool. In your CRAB, we're doing some work with our CTSC, and I see Sherry Bolin on here. She and I co-lead our community and stakeholder engagement group within the CTSC. We're building out community engagement studio model, and it sounds like a lot of what your CRAB is doing is similar to what a community engagement studio is. And I was just curious if you could talk a little bit about the connection between, if you're familiar with the community engagement studio approach, and that basically providing advice specifically to researchers, at any phase of the continuum of their project.
Do you want to take that one, Lauren?
I'll let you start and then I'll fill in if anything
Yeah,
needs to
absolutely.
be.
So if I understand the question, you're asking sort of how does the CRAB operate to some extent as it relates to the community sort of studio model of providing
Yeah.
expertise across the continuum, and I would say that is the exact approach. I know we were going to we have another number of slides, 5 other slides that kind of detail the CRAB. But essentially that was the purpose, right? So regardless of where you enter in the research process, you are able to get that support. Obviously, the thought is if it's a community engaged or based participatory research process that is happening even as you're developing the idea and the research question, but we understand that certain research and certain researchers may not be in a position, or at least where they are, to do that. And so how do we engage and be thoughtful moving forward, right? Because it could mean a course correction, it could be implementing something different. And so the CRAB has been able to provide that expertise and that knowledge. And the CRAB, and I don't know if we didn't have this specific slide, but the CRAB in terms of expertise, lived experience are across disciplines, across communities. And it really, to me, brings a wealth of knowledge in terms of thinking about not just, well, how do I execute the research in the way it stands, but what are the ways in which we could be maybe more intentional? What are some of the ways in which we might want to even decolonize the processes that are in place? But also thinking about the ways in which that research has an impact, but also can sort of fuel and allow for community engagement in the future if that researcher hadn't thought about it until maybe midway through the process. Does that help answer that question? And Laura Ann, feel free to add.
Yeah, well, and I was going to add, thank you, Dara, that was excellent. And one way that the CRAB knows where a researcher is along that process is we do have a summary form, like a research and intake form, basically, that anyone who would like to present to the CRAB must complete. And on that summary intake form are multiple questions, one of which is asking them, do they have funding? Is this a new project? Where are you in that research process? Specifically, what is it that you would like to obtain from coming to the CRAB? And so we have a checklist, which makes it a little easier for some researchers, as well as they have the opportunity to fill in the blank if one of our already items is not on their list. And they do provide us a summary. So we do obtain some background information prior to anyone coming to the CRAB, and that is reviewed first by me. And then if there's any questions, I'll reach back out to them. And then all of this process has to happen at least 2 to 3 weeks prior to their presentation to the CRAB, because after I review the initial intake form, then I send it over to the CRAB for them to review, familiarize themselves with that research study. So when the researcher team does come to the CRAB, and it must always be the PI, the principal investigator, must present to the CRAB. And that was a change that had to happen over time. And we found in earlier years where some of the study team would come and they were not able to answer some of the questions about recruitment, about the study protocol. And so that's when we elevated it to the place where the PI must come. They can come, their team can also attend, but the PI must present. And so we get some of that background information prior to them presenting to the CRAB. And then that way, when they do come, we're able to give them that type of really cultured and guidance and tailored perspective on their research. So that's how that process also works, where we find out a little bit about where they are in that continuum.
I see a couple of questions in the chat. So 2 actually from a Sherry Boland. Sorry if I mispronounced your name. How do you handle collaborations versus competition across centers? So that race-based equity center initiative, maybe you're referring to that. And I also mentioned the Pitt Momentum Funds because that is actually an investment by the university to support collaborations across entities and centers. So in order to get certain funding streams through the Pitt Momentum Fund, you have to include divisions outside of your own. So like we can't have 5, even though we have 8 departments in the school of public health, we have to involve or collaborate with centers or divisions outside of even the health sciences. So it could be nursing and school public health, but then it would also involve the school education, for example. So there is an incentive to support collaboration by the university through those internal funds. So that is one way. And then the race-based center initiative that was initiated by the provost office, once again, with investment and funding for us to do collaborative work and really think about how our interdisciplinary sort of approaches to work in these multiple spaces can really build out solutions in terms of how we engage within the university, but how we engage outside of the academic space. And then this next one may be for you, Laura Ann. How often do you meet with the barbers and hair salon leads, engage over time? How do you address their desires and needs and ideas as part of the partnership?
So interestingly, we are in the process of doing a little bit of a revamp. There was a time when we had a lot more staff at the center, and we had project directors specifically for each of the areas that we had mentioned previously. And so the engagement was more often. Now I would say it's probably about, I'd say maybe 4 to 5 times a year. It's not where I want it to be. So we're actually working on how we can bring in more partners and some student assistants to actually have a presence on a monthly basis. But there was a time when we did have a presence on a monthly basis. And some of what helps too is when we have those collaborations. I'm thinking of one we had prior to the pandemic with the American Heart Association. So they had approached us about doing a pilot program where they wanted to actually have blood pressures, almost like a little pilot where blood pressures were being done on the same client in the shop twice a month over a period of 4 to 6 months. And so when I approached the shops, they were like, yeah, this is great. What really helped us out as a center was that the American Heart Association had a liaison, actually a staff person who was going to work with the center on making sure that that happened. So, and so we kind of built in a little competition. There was a little incentive for the participants in the shop to participate in that pilot program. But the outcome was that we found, and this is something that the center already knew, but the American Heart Association wanted to actually pilot and find out if having that type of tailored one-on-one interaction between a liaison and a client would actually increase a person staying in the healthy range of blood pressure. And if it was high, or if there was a need for medication, would the person actually follow through with the recommendation of the American Heart Association to work with their physician? So we found out that, yes, that does happen. That is a positive outcome of that type of tailored intervention. So it's something like that as an example that we do know the necessity of having that more structured interaction. But me personally, I do stop in the shops, say hello. And so part of our revamp will be to bring on a couple new shops. We're going to expand outside of where we have been. Some of the current shops are actually phasing out just because of ownership changes. And so we're looking forward to this year. And then we had some of the change too with the pandemic. So, but we took that as an opportunity to do COVID vaccinations and screenings. So the touch points are still there. And it's also right about relationship building and maintaining those relationships. So I hope that answered your question.
Yeah, thank you.
Thank you so much, Dr. Mendez and Laura and Bray, for presenting. Unfortunately, we don't have time for any more questions, but we will send out the slides to everyone and share the contact information for both of the presenters today. Thank you all so much.